All right, so we are live with our COVID-19 and breastfeeding Q&A. We're going to allow people to come on and join us here for the next just few seconds here. But we're really excited about this topic. We've gotten a lot of questions about what are the best choices and options, so we're really excited to cover this. And we'll let maybe just a few more seconds letting people join. In the meantime, I am going to pull up the slides and get ready for us to begin speaking about the topic here. All right. So we're going to welcome everyone to COVID-19 breastfeeding Q&A. And we've got here Dr. Crystal and Sheila Janakos, MPH, IBCLC. We're really excited to cover this topic. We know that there are a lot of questions that come up around this, so we're excited to go over all of the different options and tips and tricks that we have here. I'd like to introduce and welcome Sheila Janakos, MPH, IBCLC, founder and CEO of Healthy Horizons with 30 years of experience and clinical expertise and clinical experience. So welcome, Sheila. We're excited to have you.
Thank you, Azar.
And then we also have Dr. Crystal. And Dr. Crystal is a board-certified Stanford-trained OBGYN physician entrepreneur and a physician lead for StartX COVID-19 task force. That's really exciting.
Thank you.
Welcome, Dr. Crystal.
Yeah, thank you for having me.
Yeah. So we're going to jump right in question here. And Michelle asks, can COVID-19 be passed through breastfeeding?
Well, so far the data shows that COVID-19, the virus, is not passed through breastfeeding, which is very reassuring. There's been several studies looking at breast milk, and there's no virus that is culturable from breast milk. The things that are passed through breast milk are maternal antibodies, maternal IgA, which can help protect the baby. And also, we now know that there are immune complexes that are in the milk that help stimulate the baby's own immune system to make antibodies against COVID-19.
Oh, wow, that's really interesting.
Yeah.
Are there any other pieces along that you think that new parents should know?
I'm sorry, I didn't hear you.
Any new pieces along that you think new parents should know about that?
Yeah, that latest study that came out where they looked at 21 moms and 22 babies, and there's other studies that have also looked at the milk, but it's really interesting that breastfeeding is going to, if a mom has either the vaccine or has had COVID, it can really help stimulate the baby's own immune system so that the baby makes something called IgA in its mouth and its saliva, and it helps protect it against COVID.
The human body is amazing about how it adapts. That's really, that's really interesting.
Yeah.
So the next question we have is from Jordan. And Jordan asks, if COVID-19 is spreading in my community, should I still breastfeed?
Actually, if COVID is spreading in your community, it's very important that you breastfeed, especially if you're vaccinated against COVID-19, because you will pass antibodies in your milk, and also, as we talked about, help stimulate the baby's own immune system. So it's protective for the baby for you to breastfeed if your community has high COVID-19 levels. Other things you can do if your baby's very young and is not able to be vaccinated, you can avoid crowds, especially if there's a high level of COVID in the community. Yeah.
This is really interesting because I do get this question a lot. I have a lot of people calling me asking about weaning. Their babies are older and they want to stop breastfeeding, and this is exactly what we need to tell people. Like, if you could do it even a little bit longer, just for this reason, you're going to be able to protect your baby.
Right. No, I agree 100% on that. Yeah, it's pretty amazing of course, if someone wants to stop breastfeeding, they can, but it will help protect the baby, especially if someone has been vaccinated against COVID-19.
I think that's reassuring for parents to know that they should continue to breastfeed and that it's going to help their children.
Right.
That's great feedback.
Mm-hmm.
So Heather asks a little bit more of an in-depth question. And she says, I'm 34 weeks pregnant and unvaccinated and had COVID last month, but I feel recovered now. Do I still need to get the vaccine if I want to protect my baby from it when I'm breastfeeding? And if so, how soon can I get the first shot? So a lot of questions in there.
So American College of OBGYN, Royal College of Obstetrics and Gynecology, all recommend that women be vaccinated against COVID-19 during pregnancy. We've seen studies that in the second and third trimester, you make even more antibodies if you're vaccinated then. So yes, at 34 weeks, this patient can get the vaccine. And even if she just had COVID recently, you usually have to wait till your symptoms are completely resolved and you're feeling well, and then you can have the vaccine. And that should help protect the baby from COVID while you're breastfeeding. Definitely. So it also protects, the vaccine also protects the mother, because women can get very ill from COVID. Luckily, this woman, it sounds like, didn't, but women can get very ill from COVID in pregnancy. And also it can help protect against things like people who get COVID can sometimes have increased risk of stillbirth, which is devastating, preterm labor, and even increased preeclampsia, which is a blood pressure disease in pregnancy. So definitely a good idea to get vaccinated if a patient would like to, and you should definitely talk to your healthcare provider about your particular case, but we would recommend that.
And would this baby be getting triple protection?
The baby would get protection transplacentally, so the antibodies go through the placenta directly to the baby, so to protect it while it's in utero. And then the baby will get the IgA from the mother when it breastfeeds, and then the baby also, because of the immune complexes in the milk, will start to make its own IgA antibodies to protect itself against COVID. So yeah, actually that's really a good point.
No, that's really helpful.
Just talk a little bit more about the baby making its own antibodies.
Yeah, so there was a study, it just came out in JAMA, and we can give the link to people on that. It came out in November, and it talks about the immune responses of neonates born to mothers. This is with people who are infected with COVID, and babies. It goes beyond just passive immunity. Passive immunity is when antibodies go through the placenta to the baby. So we do have that, the transplacental antibodies from mom. And we do have breast milk, the secretory IgA, which can help protect the baby as well. But then the mother makes spike protein, which is part of the, make an antibody to that against the virus, and they make these complexes that are kind of like this. They're like in a kind of like a cog or a wheel, and that really stimulates the baby's immune system. And then the babies make their own very specific IgA antibody in their saliva, which protects them from getting COVID. So it's fascinating. This is just new research that's come out recently, and it really is fascinating.
And I look back at the beginning of the pandemic when moms and babies were separated, they were told not to breastfeed. It's so great that we have this current information.
Right. That was a really scary time for women. And I know it's still scary for people, but we are in so much of a better place now. We know that, especially with the vaccinations, I know not everybody wants to be vaccinated, but those who would like information, we're happy to provide it. It really does protect the mother and the baby. against COVID. And we're really in a different place than we were at the beginning of the pandemic. And now if someone has COVID, we do not recommend that the mother and baby be separated. We recommend that the mother wear a mask, and a good mask, when she's with her baby, and that will help protect the baby from getting it from respiratory system of the mother. And then when she breastfeeds, it really does help the baby's immunity against the virus. So it's best for the mother to keep breastfeeding if she can and if she wants to. Yeah.
It's great news.
Yeah, I know. Really great news. Yeah. Yeah.
So Erica asks in the next question, after I give birth, should my baby still be immediately placed skin to skin and breastfeed if I have confirmed COVID-19?
Yeah, as long as the baby's doing well and mother's doing well, mom should wear a mask so that she doesn't spread anything respiratory wise, but definitely she should do skin to skin with her baby. It's skin to skin care, or kangaroo care, is very, very important for babies. It has many benefits for both term babies and preterm babies. And it also can help the mother increase her milk supply just with the hormones and oxytocin and things like that. It really helps increase milk supply, but it also helps the baby regulate their temperature. And so it is recommended. The mother will have to wear a mask, but otherwise she should definitely go ahead and do skin to skin care as much as she can.
I'm a big fan of skin to skin. Thank you so much for talking more about that. I mean, just the fact that it helps regulate the baby's blood sugar and temperature, it's fabulous. And plus the hormonal interplay between mom and baby. Also, studies have shown that moms tend to have less anxiety and feel calmer, right? Because the baby's on them, and the baby also like more stable heart rate and blood pressure. So it's just everybody wins. Plus all that good flora that gets passed back and forth. It's just great. And I really hope that the COVID situation is not interrupting people having this opportunity.
No, I agree with you 100%. It's very, very important. Now, obviously, if a baby's sick or there's a concern or mother's bleeding or something's happening, then obviously you want to do what's safest. But it has so many benefits, skin to skin or kangaroo care, for both the mom and the baby. And so I highly recommend it as well. It's really sweet, when someone has their baby and you put it up on their chest like that. It's really sweet. Yeah.
And then if for some reason the birth parent can't do that, the partner should do the skin to skin.
Yeah, definitely. Yeah, we see a lot of partners that will do that because that helps the baby regulate its temperature so well. And as you said, it keeps the babies are calmer and their heart rates are better, and overall they just do really well. So that's always an option, as long as
I always tell them it doesn't help their milk supply.
You never know. You never know. But no, probably not if the hormones aren't there. But it is very, very nice for everyone, and it's also physiologically it really does help. Again, heart rate, temperature, things like that for baby. And so, yeah, we highly recommend it if at all possible. Yeah.
So Lauren asks here, if a sibling has COVID-19, what should she do?
Well, that's a really good question. And I think that we will see a lot of this. A lot of people are having their second or third baby, and the other children are in preschool or go on play dates. And children under age 5, as we know, cannot be vaccinated yet against COVID. And so they have a higher chance of getting COVID. So it would be really hard if another child has COVID, but I think you're going to have to try to separate them as much as possible. It depends on the age of the child. Children under 2 years cannot wear masks. children over 2 years to 3 years old can, with supervision, of course. And so I would talk to your own pediatrician about what they recommend, but I would probably separate the siblings as much as possible until the older child is testing negative on an antigen test for COVID. You'll still, if you're nursing and you are vaccinated or have had COVID, you're going to pass your antibodies to the baby while you breastfeed. So that's always good if you continue to do that. And if you have someone else who can come and take care of the other child, that would be ideal, but it's not always possible. So just trying to keep them as separate as possible. If they're older than 2 or 3, they can put a mask on. Of course, hand washing is always very important for any infection. We want to make sure, and we see here this little baby has its hands in its mouth, and children tend to do that quite a bit. So we want to make sure that they know to wash their hands, and maybe they don't hold the baby, they could just see the baby, but it's probably best if they're separated. But again, I would check with my pediatrician or healthcare provider to see if that's appropriate for your particular case.
No, that makes a lot of sense. Sheila, did you have any clients or new mothers that have run into this? Or
Absolutely. And this is a question we get all the time. You know, the child brings it home from preschool, just like you said.
Right. Yeah, and now I don't know what will happen in the near future. They're starting to get rid of mask mandates in a lot of places. It depends where you live, as far as whether or not people will still wear masks, whether or not children will still wear masks. So we'll just have to see what happens over the next, school year, what happens as far as COVID and the older children. The older children definitely can be like, can bring it home to the younger siblings. It's always been like that for any kind of disease, chicken pox in the old days or colds or things like that. And so, if an older child is sick, you always try to keep them separate from the baby. But with COVID, it's even more important. Yeah. Especially during the time of Omicron, where we're seeing, babies that are having more problems with Omicron than we used to have with the other variants. Fortunately, though, Omicron, the peak is really hit, and the cases have really gone down significantly in most of the United States.
I think people don't realize that it did affect the younger children
Right.
differently than the other ones. There's still this misconception that they don't get sick.
Right, exactly. People think that children, young children don't get sick from COVID, and most children won't get that sick. Some really do feel rather lousy, but some of them with Omicron, it's different than the other variants. With the other variants, you might see something going down lower in the lungs, and the little children didn't have that much of a problem with it. But since Omicron's more upper airway and we get more of a bronchiolitis, you see more croup, which is a really wet cough that you hear. And whenever a young child has a severe cough, a lot of times they'll be admitted to the hospital. Luckily, those children mostly have done really well, but they do need to sometimes be admitted for respiratory support, with them. So.
no, that's really good feedback.
Mm-hmm.
Norea asks, if I have COVID-19, should I wash my breast before feeding my baby directly or before expressing milk?
So actually, this is a great question. You don't actually need to wash the breasts before you breastfeed if you have COVID. You definitely need to wear a mask like this woman is in the picture. The times that you would need to wash the breast is if you happen to cough, if your top was off and you happen to cough or sneeze in the chest area, then yes, I would recommend just using soapy water and a washcloth to wash off the breast. But otherwise, generally, you do not need to wash the breast. You just need to wash your hands before you pick up the baby, and put on a mask. Actually, just wear a mask probably at all times if the baby's going to be near you.
Dr. Crystal, I do have a question. In this situation, would you have the mother, what type of mask would you suggest?
Well, because Omicron has been so much more contagious than the previous variants, I would recommend, if you can, to get a KN95 kind of mask like this, or an N95 mask. And definitely wear those. Make sure that they fit very well around the face, that it's tight around the face so that no air is escaping. In this picture, we see a woman, she's wearing a surgical mask, which is actually better than a cloth mask. Cloth masks were fine before Omicron, but now because Omicron is so much more contagious, you really need to wear a high quality, either KN95 or N95. You can buy them online, but you have to be careful where you buy them from. There's something called Project N95, and you can go on there and see which ones are recommended. Also, the FDA has a list of which ones are recommended. And then you should wear the mask. You want to make sure if it gets dirty at all or wet, and you need to change the mask as well. So make sure that you have plenty of those around if you have, especially if you have COVID. Do you have anything to add to that? No.
I just think that, it's good for us to realize that things have changed and
Right.
a better prevention.
Right.
Yeah.
Yeah, I agree. And we just have to be, watch and see what's happening. I mean, I know it's all very scary, but information is power, knowledge is power. And so we just need to know things and we can work around them. Now we know we need to have these kind of masks. And luckily these masks are available now. They weren't in the beginning of the pandemic. They were very hard to find, even for healthcare providers. So things are changing over time. We have better ways of protecting ourselves. And so we should use those whenever we can.
No, that's great to note the changing times and how we adapt to that. Sophia asks, while pumping with COVID-19, are there extra measures I need to take when handling my milk, storage containers, or feeding utensils?
This is a great question. So we want to make sure that anytime you pump or, anytime you have containers that you're going to use with your breast milk, you should always wash them in between uses. So if you pump, you should definitely, after you pump, you put away your milk, you wash all the components that are washable. And Sheila, you can probably talk to this even more.
Yeah, we've had people in the past take their pieces of their breast pump and put it in a plastic bag and throw it in the refrigerator, thinking they were going to keep anything from growing. And we have to really just, again, tell people that we really want to make sure that after each use, we're really washing those pieces and letting them air dry. It's really important that we don't just throw them in a bag. If you don't need to be boiling everything like we used to tell people, but just hot soapy water is really what we need to do.
Right. And it's so important, not just for COVID, but also for other things. You don't want the baby to get sick because of some other bacteria. That milk, has proteins in it and has sugars in it, and bacteria love that. And so you want to make sure that after each use, you definitely wash the flanges and, all the different parts that you need to, so that it's ready for your next pumping session. Yeah.
And then if you don't have time, it's better to have a second set.
Right. Exactly. And people do sometimes carry around, it depends, how your work is. Hopefully that you have a place where you can wash your supplies and just keep a little bottle of, dishwashing soap. You just need a few drops in there, foam it up, rinse them off, and then just rinse them really well. And as you said, air dry. But that is definitely very important for a number of reasons. And we should continue doing that, like people should be doing it even before COVID, but especially now that we do have COVID. But you don't, I just want to say, I wouldn't put any harsh chemicals like, Clorox wipes or all this kind of stuff, and anything that's going to be near the breast or touching the baby. What do you think about that, Sheila?
I agree. I think just soapy water.
Soapy water, exactly.
Yeah.
That's the best. That's the best. Okay.
There's some really good tips in there for parents to be able to keep track of all of that. We do have a question that came in from YouTube, and Jane asks, my partner works in a high risk for COVID exposure job. I'm worried he'll expose our baby before we know if he was sick or not. What should she do?
Well, that's a really good question. I mean, there's a lot of people who are forward facing, who either are healthcare workers or teachers or other people who might be exposed to COVID. Definitely the most important thing I think you can do is to get vaccinated against COVID, because even though there is a chance with Omicron of getting a breakthrough infection while vaccinated, it lasts a shorter period of time, and people don't become as sick. And I think now we're able to get some tests from the government to test if you have COVID. So if anybody ever has any COVID symptoms, I would definitely use one of those home tests if possible, and just make sure somebody doesn't have COVID if they come home. But if there's any concern, that person could always wear a mask when they're around the baby. That would protect the baby as well. And just I'm sure that if they're in a high risk profession, that they probably are getting tested periodically as well. Yeah.
That was my next point, is hopefully they're getting tested on a regular basis.
Yeah, no, definitely. Because, and I think that that's a big fear of, I see this all the time on Twitter, with some of my colleagues, the doctors and nurses, they always worry. Their biggest worry was, especially before vaccines, was that they would bring COVID home to their families. And so, just being extra careful. The studies actually show, though, that people tend not to get COVID as much at work, in healthcare fields. They, working in a hospital, clinic, or even a long-term care facility, they tend to get it in their personal life. They tend to get it if they go in a group with friends and they think the friends are all, okay, and nobody has symptoms. And that's where people tend to get COVID more often, because in the hospital, the nurses and doctors and other employees are all wearing the really good masks, are washing their hands very often, and wearing other protection. And so actually, they find that you just need to be careful in your personal life and your professional life. And so right now, we're in a better spot right now. The positivity rate of COVID and tests is only about 4 to 5%. Before it was much higher during the Omicron wave. So we're kind of in a better spot right now, and just, use the usual precautions. Yeah.
I could totally see this being an issue, especially if, let's say, the partner works at a correctional facility, someplace where there's maybe a higher chance. And I think all those precautions make perfect sense.
Yeah, well, it's very important, if the partner's going to be with the baby, that they wash their hands. That if they are super high risk, I would wear a mask, test periodically to make sure that they don't have COVID, and that should really help protect. And then also, if the mom continues to breastfeed, that's going to give the baby immunity through the milk as well. So these things are all important to do.
So we do have one more live question that came in, and we do want to try and keep this to around a half hour, but I think it's important to take hold of this one. They're referring to the antibodies that you referenced in breast milk. Mm-hmm. And the question is, because there may be COVID antibodies in my breast milk, should I give it to my 4-year-old? And I'm assuming that they had stopped breastfeeding the 4-year-old, and they're wondering if they should then give it to the 4-year-old now.
I've actually heard people talking about this on Twitter as well. It depends how much milk you have. and it depends how much. Maybe Sheila, do you want to
Yeah.
answer this?
I think your point about we don't want to take away from the baby.
Right.
The baby comes
needs
first.
nutrition. Right. Definitely.
If the parent is pumping extra milk, absolutely. And if the older child's willing to take it. So the parent may have it, but the child may not be interested. But
Right.
I think if it were possible, absolutely, that child still would get benefit.
Yeah, no, definitely. Definitely. You know, but you need to make sure that you have enough milk. And a lot of times it's hard getting enough milk supply for the younger baby. Some people that are very fortunate and they can make enough milk for both. So yeah, I agree with you on that. It definitely wouldn't hurt the older child. The only thing it could do would be helpful, I believe,
Right.
For that child. So it's not a bad idea. But I think practically it might be hard for a lot of people who don't have a lot of milk.
But probably even 3 to 4 ounces a day.
You know, yeah, especially with this new study showing the spike IgA immune complexes, how it stimulates the baby's immune system to make its own IgA antibodies. It could do that for the older child who can't be vaccinated. It's almost kind of like a vaccine. You know, it turns on the immune system. It's different, but it turns on the immune system for the child who is getting the breast milk. And so, yeah, I agree with you. It's an interesting thought, really. But hopefully in the next few months, we'll have vaccines for the younger children as well, the under 5s. Yeah. So.
Oh, thank you for answering that live question. Overall, what do you think the takeaways for new parents should be based off of the items that we've spoken about? I do want to mention really quickly that Dr. Crystal created a handout for us to send to anyone that signed up. So we'll be emailing that if you signed up for the live. We'll also have it in the description for wherever you're viewing this to be able to click on that and obtain that handout. But Dr. Crystal and Sheila, are there any takeaways that you'd like the new parents to know?
Basically, you know, as a healthcare provider, we understand that this is a very stressful time for you, and we're here to support you. That if you can and you want to breastfeed, that would be very helpful for the baby and its immunity. And that you should that if somebody has COVID, they definitely should wear a mask anytime they're near the baby, and wash their hands frequently. But it's important. It's the benefits of breastfeeding outweigh any risks of COVID to the baby, and actually the antibodies and can help the baby be protected from COVID. So anything else, Sheila, that you'd like to add to that?
I think you nailed it on the head, that it's going to be beneficial if the parent chooses to do that. So at this point, there's no reason not to, which is the good news.
Right.
Yeah.
And yeah, every family is going to be different as to what they feel comfortable with. But if they would like to breastfeed, it would be definitely beneficial for the baby.
Great.
Wonderful. So we do have also some resources. Dr. Crystal has a COVID weekly newsletter summary, and you can find that at drruth.substack.com. We'll also have that in the handout that will be either in the description or emailed if you signed up for the live. Dr. Crystal also has a very large following on Twitter at Catch the Baby, where she goes over a lot of different questions in relation to everything. Do you want to speak about what you speak on there, Dr. Crystal?
Well, I tend to put a lot of things about COVID because I'm on the StartX is Stanford's startup accelerator. So I'm on their COVID task force. So I do read a lot about COVID every day. And so interesting findings I put on there. And that's also the weekly newsletter is all news about COVID. It's not just COVID and breastfeeding, but anything that we find out about, you know, anything related to COVID, usually put it in there. Yeah.
That'll be a wonderful resource for new parents. Absolutely. Mm-hmm. And we also have Healthy Horizons breastfeeding available on all the different social media channels. We wanted to thank everyone today. Healthy Horizons is presenting this COVID and breastfeeding Q&A, and our mission is to empower breastfeeding parents at work and at home. And we're the first company to offer comprehensive lactation at work benefits at scale across North America and support breastfeeding families with lactation consultations and support groups, as well as breastfeeding and baby products. Thank you so much, Dr. Crystal and Sheila, today for answering all the different questions that we had.
Thank you.
Yeah, thanks for inviting me. Yeah.
Wonderful. Thank you for everyone that has joined. And we'll be moving into away from the live, but thank you again, everyone who has joined. We appreciate it.
Bye.